start to set up to feed a tumor, we can start seeing that and use it as a monitoring device for these women. And another thing that it's really nice for, because we were talking about young women, is women with augmentation, when they've had implants. You do not want to do a mammography on a woman with an implant, because you can rupture their appliance and spread whatever it is, saline or even worse, silicone throughout their system. So I frequently have clients coming in, and it's a wonderful technique for not only looking at their breast for breast health, but we can see if their appliance has ruptured, if there's an inflammation, encapsulating that and letting them know that they need to get surgery and get it removed, or whatever. So it's a very interesting technique, and a lot of these doctors are I'd say the leading doctors in their country, who are into keeping up on the latest techniques that are out there, are a lot more open to finding out about this tool and how they can use it, and understanding what the interpretation of the study means.
Interesting. So it sounds like it all comes down to education again, then, doesn't it?
Yeah, absolutely.
They don't understand it, or they haven't studied it, so of course they oppose it because they really don't know what it's all about or what it's going to do.
Well, it's not that simple, in that there has been a lot of negative publicity put out there by the radiologists.
Okay. Now, why is that, Nancy?
Well, once again, they don't understand how to use it, and I think the most common thing I've heard is that it has too many false positives, in that we're seeing things really early. And the nice thing about that, though, is if you understand when they put their hands in cold water, if it's early, it's going to contract down. If it's advanced, it's not going to respond. So just because we see it early and the mammography can't find anything doesn't mean that it's not there.
Exactly.
You understand what I mean?
I totally understand.
So, we could have a little debate here about that.
Oh, yeah, definitely. Now, as far as thermography, there's a lot of women out there, as an example, they say, I don't want to take a mammogram. I don't want the radiation, I refuse it. And their doctor says, well, you need to take it, and they're saying, I don't want to take it. There's a debate there, right? If they started with thermography, say at age 25 or 30 or what have you, and they did thermography all the way through, would they be safe?
Well, I personally believe that it's going to show something really soon. I think the only thing that thermography misses is a DCIS, which is ductal carcinoma in situ.
Okay.
And a lot of the doctors are treating ductal carcinoma in situ as if it's cancer. And in all honesty, it's not.
Okay.
It's just like cervical dysplasia, it's dysplasic cells, it's dead cells. And to me, my personal opinion is, if there's no veins feeding it, it's encapsulated in the ducts. I think you just basically need to boot their immune system up. I don't think you need to be doing radical surgeries on these women, or even lumpectomies, because once you start cutting into them, then you're spreading it outside the ducts. Even a needle biopsy. It can be detrimental.
Sure.
Now, I've talked to a lot of doctors, the surgeons, and they say neither can mammography pick up DCIS. So when they were telling me, oh, well, does thermography pick up DCIS? I said no, and I said, well, how does mammography do? And they go, oh, no, it can't pick it up. But what it sees is calcifications.
Okay. So
a lot of the scares that women get is, well, we see microcalcifications in your mammography, we need to do a biopsy or further testing. Only 20% of those go on to be an early warning, a DCIS.
Wow.
80% of them it's nothing.
So in other words, if they left it alone,
nothing would happen.
They'd be fine.
And even if we do see calcifications, like if a client comes into me and says they saw calcifications in my mammography, and we do a thermography and they get a wonderful reading, no abnormal vascularity, I still would put them on a nutritional program, and I don't charge extra for that.
Good.
I go over the results and put them on a nutritional protocol to address building that immune system up and getting the body to clean out this.
Exactly. Well, see, that's what I believe in, prevention. That's why we do this show.
Yes, sure.
We got to get out there and educate people so that they got enough knowledge so they can start some prevention.
Absolutely.
And I think that things like we're talking about tonight, thermography and early detection of breast cancer, if this is a non-invasive tool that has no harm to the body, then why not use this routinely in doctors' offices throughout this country? Why shouldn't it be used?
Absolutely. I think that's a really important factor, and I think the more we become familiar with it, the better. the better it's going to be for everybody concerned. Is that it's a wonderful tool. It's not 100% perfect,
sure,
but you know, that along with women learning to do their own breast exams, and through my nonprofit I do teach women how to do their own breast exams, and I come out to any group of women and teach them all the things they can do to lower their risk factors for breast cancer.
Wow, well, you're a busy person.
Yeah,
you're
I like doing
teaching. That's all you're doing out
that's
there.
what it's important.
Yes.
And I think a lot of it, the more educated women get, the less they're fearful. It's the fear of the unknown. So
absolutely,
we want to avoid that.
Exactly. Let's talk about, as far as Europeans, you know, you hear a lot about they use thermography over there a lot. They use a lot of modalities that are very preventive or non-invasive modalities. Why in this country they seem to just kind of like oppose these things, or they don't want to promote them?
Well, most of the money, you got to look at where the money's going, is into you know, research on drugs and the cure, looking for the cure versus looking at prevention. And it's not just Europe, it's all over in Canada. Most of the research on thermography has been done in Europe and Canada because they're the ones who have been able to get money for it. I've been trying for years through my nonprofit to get funding to do research, and there's just, for all the groups out there trying to find the cure for breast cancer, I have not found one group that's willing to do some research into looking at these protocols that I'm putting people on that are able to turn around these early signs.
Could you imagine if you got some funding for these?
Yes,
so
I think it'd be great.
You could really get into a really good big study here?
Absolutely,
incredible.
And document these things so that you can really realize that it's within our hands to do things, to make changes.
Absolutely.
It's not like some unknown thing that's off way past the horizon.
Exactly.
It's right here, right now. It's available.
Well, let's face it, people today, and you know that, and you probably see it every day in your clinic, are looking for non-invasive procedures to do. They don't want to get the radiation. They want to find out ways of prevention. I mean, we're in 2001 now. We're in the new millennium here. So people are looking for answers.
Yes, they are. And they're more interested in holistic ways of dealing with things and using herbs versus drugs because the side effects are so much less. They're not as traumatizing to the body. So yeah, it's a great new adventure for us all.
Exactly. Now we talked about it, environmental as an example. All the pollutants, environmental. That has a lot to do with carcinogenic factors in the air.
And the reason it's so important for breast cancer is because they're called xenoestrogens. They're what causes the angiogenesis, or those veins to feed the dead cells or abnormal cells. Okay. So we want to avoid the estrogens from petroleum products and from plastic.
Yes.
Those are what's causing breast cancer.
Again, it all comes back to education.
Yes,
I mean,
absolutely.
that's really what it's all about. Now, as far as mammograms, do you have people coming into your clinic that just refuse to take mammograms?
Oh, yeah.
They just don't want to do it?
Lots of them, hundreds of them.
Okay.
I was amazed when I first started this because I refused to do them, and that's why I found another technique.
Good for you.
But I was shocked at how many women who were told to get their mammogram every year just said, I don't think so. And I'm like really proud of them to look for something else, you know, to look for another option.
Now, as far as thermography